The Roma Influencer Network aims to reduce early marriage and early motherhood in Roma communities.
This initiative brings together organizations from Greece, Ireland, Portugal, and Romania in a 2-year project that means to empower Roma women and girls.
This audio presentation is based on findings from the Ireland National Report and the comparative report on early marriage and early motherhood in Roma communities, both produced as part of the project.
UNICEF reports that 12 million girls marry before the age of 18 each year, increasing the likelihood of adolescent pregnancy and early motherhood.
According to the World Health Organization, complications related to pregnancy and childbirth are the leading cause of death among girls aged 15 to 19 years old worldwide. Children of teenage mothers are also more likely to be born prematurely with low birth weight or neonatal health problems. The consequences of early motherhood are not limited to health. UNICEF emphasizes that early marriage often marks the end of a girl's education and the loss of her autonomy and economic opportunities. In Ireland, child marriage is illegal. In terms of early motherhood, data from the 2022 census shows 798 teenage births, with 19 of those births to mothers aged under 16 years old. Data on early marriage and early motherhood remains scarce, and there is a lack of dedicated studies examining these phenomena in depth. In terms of population, Romania had the highest proportion of Roma people, and Ireland had the lowest. The size and proportion of Roma communities in the partner countries differ. However, they share many challenges and difficulties, placing them among the groups most prone to discrimination and segregation in all 4 countries. Across the countries, the Roma population are usually younger, more at risk of poverty, housing deprivation, low educational level, discrimination, poor health, and high unemployment.
A total of 184 interviews were done with the Roma women in all 4 countries involved in the project. This research took a peer researcher approach, and in Ireland, 5 Roma women interviewed 30 Roma women in their community.
All of the people interviewed were over the age of 18 and were either married parents or both.
The most common age group of women interviewed was 20 to 24.
Half of the women live in overcrowded housing, and over 10% consider themselves to live in the private housing in bad conditions. It is also important to note that many Roma women in Ireland are migrants from Romania or other European countries. This sets the Irish context apart from the other partner countries, where Roma are usually citizens of the state in which they reside, and add an extra layer of complexity to their experience.
Among the respondents in this study, the majority were either married or cohabiting, while only 2 women were single or widowed. Most participants got married or began living as a couple between the ages of 15 and 70 years old.
Literature from the 4 partner countries identified several reasons that can contribute to and justify early marriage, including low education levels, poverty, and patriarchal society.
In Ireland, among the top 3 reasons for getting married at the age they did were
This is the usual age among the Roma community.
That's what I wanted.
Familia mea era foarte dorită ca să mă căsătoresc.
My family really wanted me to get married.
However, over half of the women surveyed in the 4 countries said they will wait a little longer to get married. This response was most common among those who married before the age of 18. In Ireland, before marriage, about 60% of Roma women interviewed lived with their parents and looked after their family and home, and 40% were still at school.
After marriage, life changed in many ways for the respondents.
I stopped being someone's daughter and became someone's wife.
I moved in with my in-laws.
I couldn't go to school anymore.
I started to feel more respected.
Mi-am pierdut libertatea. I lost my freedom.
I began to feel that I had a voice in the community.
It gave me more freedom.
I couldn't go to work anymore.
I started to feel the pressure to have children.
In many Roma cultures, becoming a mother is seen as an important milestone, marking a woman's full participation in community life and reinforcing her status and influence within the family structure. Through motherhood, Roma women play a role not only in raising children, but also in preserving traditions and values across generations. In the context of this study, the Roma women interviewed in Ireland had the highest number of children, with an average of 4.1 per woman. In addition, the majority of respondents gave birth to their first child between the ages of 16 and 17. More than half of the women said they would like to wait a little longer before having their first child. Reasons for wanting to have children later in life included wanting to stay at school longer, not feeling ready to be a mum, and wishing they had more time to play. Data from the comparative report showed that Romania has substantially higher adolescent birth rates than the other 3 countries. Romania has the highest rate of underage girls giving birth. In 2023, 648 births were registered to mothers under 15 years of age, and 14,714 births to mothers aged 15 to 19 years. For women in this project, average age at the birth of their first child varied from around 16 in Romania to 19 in Portugal. In terms of pregnancy information, women from Greece and Portugal felt that they had adequate information. On the other hand, women from Ireland and Romania say they do not have adequate information. Of the Roma women interviewed, the highest percentages of those who attend hospital or medical appointments to follow the pregnancy were found in Greece and Portugal. In Ireland and Romania, those values are much lower. Many respondents reported facing difficulties in accessing healthcare services due to language barriers, fear of paying fees, or not understanding the importance of appointments or how to access the health system.
Use policy measures to ensure girls and young mothers can remain in or return to education through flexible pathways, practical support, and childcare options. Support service delivery approaches that build trust with Roma communities, including community-based outreach, peer-based support, and engagement through trusted Roma individuals and organizations.
Support community-led discussions with Roma communities on early marriage and early motherhood, including education, health, and rights.
Implement targeted programs for Roma girls, focusing on building self-confidence and informed decision-making. Programs should be designed and delivered by Roma peer support workers with support from relevant public services and NGOs.
Ensure Roma women with lived experience are meaningfully involved in the development, implementation, and review of policies and services affecting them.
Address the wider social determinants of early marriage and early motherhood by recognizing that they're often rooted in broader structural inequities, including poverty, low educational attainment, discrimination, and limited access to services. Provide funding for multi-sectoral initiatives that address these intersecting challenges.
Strengthen ethical data collections across sectors to better understand needs and inform effective responses.
Continue studying so that when you have children, you are prepared to offer them a good education and be able to offer them better opportunities.
This does not depend on girls. It depends on the parents and educations in home.
Wait to grow up and hope that in the future you have all the time in the world and finish school first.
Parents should stop being afraid of sending their girls to school. We have to prioritize education. We have to break the cycle, and this will be achieved by first educating parents so that they do not repeat the cycle. Everything bad in the world is fought with education so we can fight better for our rights.